everyone, this is Shabnam here. In today's video, I am going to speak about ADHD, the different types of ADHD signs and symptoms, as well as the diagnosis and the treatment options which are available. So ADHD stands for Attention Deficit Hyperactive Disorder, and it is a brain disorder and a medical condition. Here the development and functioning of the child's brain who has ADHD would be different from that of the normal child. And this will lead to problems like inattentiveness, lack of self-control, as well as problems in regulating the emotions. Usually this runs in the family and it's associated with the genetic factor, and as per the research, if the parents have ADHD, there is 40 to 50% chance that the child would also get it. There is no permanent cure for this. Only thing is that medications would be given to manage the symptoms. Based on the different symptoms, ADHD is classified into 3 different types. The first type is known as predominantly inattentive presentation. Here the child will find it very difficult to focus or pay attention to his tasks. He will not be able to complete his task as he will get easily distracted and easily bored with the tasks. As well as he will have problem in planning as well as organizing the tasks. He forgets things easily as well as loses things. And he will not be able to listen to when people are talking to him directly. And he will resist or he will dislike any such activity which involves a lot of mental effort for quite some time. The second type is known as predominantly hyperactive or impulsivity presentation. Here the child will always be in motion. He finds it very difficult to be seated in one place. He keeps fidgeting with something, or sometimes you will find him just running, jumping or climbing in places where he is not allowed to. He speaks a lot as well as he will interrupt while others are speaking. Sometimes he will act or he will speak without thinking, or he might just run across the street without seeing the traffic. He finds it very difficult to wait for his turn or to wait for the things which he really needs, as well as you might find him blurting out answers before the question is asked in the class. The third type is known as the combined presentation, wherein this is ADHD, wherein the child will display the symptoms of both the first and the second type. But usually the symptoms change over time. If you see, when the child is small, the main hyperactive and impulsive symptoms would be predominant or pronounced. But when the child becomes an adult, young adult, or in the adolescent stage, you will see that the child will have more problem in paying attention. Now let us see how the diagnosis of ADHD is done. There is no one particular test for the diagnosis of ADHD. A series of structured diagnostic interview would be conducted by the mental health professional who is an expert in ADHD. And he will try to collect a detailed information about the child's day-to-day functioning in different settings from various sources like teachers, from the parents, from the child, as well as people who are closely associated with the child like coaches or the caregivers. And the main purpose why this information is collected is that the therapist would like to identify what is the difference in the functioning of the child compared to other children of similar age. But some of these symptoms even a normal child would display in some point of his life, as well as children with behavior disorders also display these symptoms. So to exactly diagnose that the child has ADHD, there is a set guideline or criteria for the diagnosis of ADHD. So here the first point is that the child must have these symptoms or display these symptoms in at least 2 areas like home as well as school or some social setting. Second thing is that if the child is 4 to 17 years old, then the child should display at least 6 or more of these symptoms. And in case the child is above 17 years, he should display 5 or more than 5 of the symptoms. The fourth point is that these symptoms should be present in the child for at least 6 months or more than 6 months continuously. And these symptoms should be identified before the age of 12 years, as it is a childhood disorder. Now let us see what are the treatment options available for ADHD. As ADHD is a medical condition, so stimulants and non-stimulants would be prescribed. Stimulants would be given to the child to reduce the hyperactivity and impulsivity and to promote concentration or attention. Second thing is that behavior therapy would be given to bring about a positive change in the behavior of the child, as well as the therapist will teach the child some social skills like how to ask for help, sharing, cooperation. The third thing is that cognitive behavior therapy would be given where more emphasis is given to the mindfulness to enable the child to recognize his thoughts and feelings as a way to improve his concentration or attention. And the fourth one is ADHD coaching would be given, wherein the coach will help the children to set and to work towards the goals as well as to improve their functioning as well as productivity. Sometimes counseling would also be given. And most of the children who are found to be ADHD also have learning disability like dyslexia. So other therapies like speech therapy, occupational therapy would also be given to your child. The last thing is that training and education would be given to the parents as well as to the teachers to teach them to handle or manage the ADHD symptoms. So what you have to remember is that there is no permanent cure for ADHD and medications are given only to manage the symptoms. And if these symptoms are not treated at the early age, then it will continue into the adulthood and create problem in the person's life. So hope this information was useful to you, and in case it was useful to you, please do give me a thumbs up, do subscribe to my channel The Counseling Corner, share my video with your friends, and the most important is hit the bell icon so that you get timely notification whenever I post my new video.